Hello, and welcome to the University of Kansas Health System Overland Park Cancer Center location. Overland Park Cancer Center was acquired by the health system back in 2011. Here, we provide care to patients requiring chemotherapy and immunotherapy treatment, radiation therapy, as well as diagnostic imaging that includes CT and PET scan imaging. Our location supports 6 oncology physicians, 6 advanced practice providers, and 3 radiation oncology providers. We are also lucky enough to have 10 oncology certified nurses on staff as well. Overall, Overland Park Cancer Center services approximately 150 patients per day. We have selected just a few faces from our incredible staff here to share what they love most about working at Overland Park.
Hi, my name is Ellie Sixta. I'm a nurse in radiation oncology. I work at the OP Cancer Center for about 6 years now, and I am oncology certified. So in radiation, we have a great gift of continuity of care. We see our patients Monday through Friday, 5 days a week. Radiation therapists are able to visit with our patients and treat our patients Monday through Friday. We have a patient who's actually on treatment right now who is going through a pretty hard treatment. She's going through both chemotherapy and radiation. And lately, she's not been feeling great. It's kind of been catching up to her. And where the teamwork aspect comes into it is that our therapists are able to let us know, hey, she's not feeling great, or hey, she just looks a little off, a little different from yesterday. Can you come and talk with her? And we're able to come and grab that patient, sit with them, and kind of take time and see what's going on and see what changes are since the last time we saw them. She was having a hard time, and I went and talked with her and her husband, and I went ahead and grabbed my doc, and we went in there and talked with her about 30 minutes, coming up with different options and different ways that might make things go more smoothly. And at the end of it, we left with a plan. My provider was able to go talk to medical oncology and work with them on a plan as well. And the goal is we can make her start feeling better and be able to complete treatment. And I really feel confident, and the patient felt confident that we were able to come up with that plan. And none of that would have happened without our therapist keeping us informed and just everybody collaboratively working together. So that's why I love working here.
I am Aubrey. I'm one of the nurse practitioners here at the Overland Park Cancer Center. So I started here back in 2019 as an infusion nurse. Did that for almost 4 years and absolutely fell in love with not just the patients, but also my coworkers. Very much felt like a community and a group of what I would call friends. During that time, I had the opportunity to go back to school and get my master's to be a nurse practitioner through the help of KU's education program. After that, I ended up taking a job elsewhere, but always knew I wanted to find my way back to KU. And after about 2 years, everything just aligned perfectly. And not only did I get to come back to KU, but I got to come back to the Overland Park Cancer Center as a nurse practitioner, where it just really feels like I'm coming back home.
Hi, my name is Drew Husky. I'm one of the clinical oncology pharmacists here at KU. I work at the Overland Park Cancer Center. I've been here for about 8 years now. Most of my time is spent with oral chemotherapies, but sometimes I also work here in the infusion room where we prepare IV and sub-Q IM medications. The nurses are great here. Everyone's so friendly. I think it speaks to our culture here. From the top down, everyone's very willing to work together in an attempt to prioritize the best patient care possible.
Hi everybody, my name is Astrid. I'm an infusion nurse here at KU. I have been here for about 3 years now. I will say what I like the best about being at KU is our patients. Being a nurse to me is kind of being like the little sunshine in everybody's day. If I can make somebody's day better, that's what I aim for every day. Not just our patients, I guess, but also with our staff. Just trying to do the best care that I can for everybody.
Hi, I'm Carlene Keys, and I'm a nurse here in infusion, University of Kansas Cancer Center at the Overland Park location. And I came to KU 28 years ago. I came purposely to a university setting. And what I love about that is the learning and the dedication of everybody, even from the doctors and all the way down. We're committed to finding a solution for each individual that we see. Treat them with respect and kindness. I'm working with the most dedicated and kind individuals, caring that you could ever want to be with. That's what I appreciate.